this afternoon, at which time we'll and thanks again for your patience. And Dr. Shafer, after the jurors leave, you may step down as well, remembering the admonitions, and please come back at 1:30.
Now, how would the pulse oximeter have operated just prior to Michael Jackson's death? You described that there would have been an airway obstruction. What would you expect to have seen or heard?
Are you referring to the non-in Onyx 9500, or do you want to talk about a proper monitor?
A proper monitor.
In a proper monitor, Michael Jackson, with good lungs, breathing supplemental oxygen, would typically have an oxygen saturation of 100%. All of his blood is completely saturated with oxygen, 100%. When he stopped breathing and had a respiratory arrest, at that point in time, the oxygen in his lungs is starting to be consumed by the blood that's going through it, but it's not being replaced. So there would be a delay of a few moments because he has a reserve of oxygen in his lungs. And the delay might be as long as 30 or 60 seconds. But then, what would happen is that 100 would start to fall to 97, 92, 88, 80. At the same time, you'd hear that pitch, that doot, 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 doot. It starts to fall, and you hear that instantly, and you know there's a problem. When it reaches a certain set value, I think typically it's 92, but it's adjustable, then alarms start to go off. Alarms to alert you, this patient is in trouble. That I would expect to have happened within 2 to 3 minutes, and it makes it impossible to miss the fact that the patient is in serious trouble and requires immediate intervention to return the flow of oxygen to the lungs. That's what would have happened if that device had been present.
And if Dr. Murray had been prepared with a proper pulse oximeter with alarm, would you agree that that likely could have saved Michael Jackson's life?
That would have saved Michael Jackson's life.
You next talk about the blood pressure cuff, and you find that to be independently an additional egregious violation. Can you please describe your findings and opinion in that regard?
Yes. Propofol lowers the blood pressure. It lowers everybody's blood pressure. It's an expected effect of propofol, which is usually of no consequence to the patient. However, in the operating room, when we see this, we treat this with additional saline solution, or we may choose to treat this with drug, or we may choose to treat this by giving less propofol, turning down the rate of the infusion. In the case of Michael Jackson, who was dehydrated, without monitoring the blood pressure, there was no way of knowing if he was at risk of an exaggerated response. The reason a drop in blood pressure is associated with an exaggerated response is when the blood pressure drops, your body, which normally all the arms and limbs are being perfused, starts to close off the arms and limbs and just preferentially circulate blood to the vital organs, the gut, the heart, and the brain. With a loss in blood pressure, the drug becomes more potent because it winds up primarily going to the vital organs rather than throughout the body, because the body is responding to the drop in blood pressure by shutting down the flow in your arms and legs. So you have to watch the blood pressure. You have to watch it carefully. And the blood pressure is always monitored when these drugs are used. 100%. Not monitoring that, not knowing if Michael Jackson was having a drop in blood pressure, raises the possibility of an exaggerated response simply from the low blood pressure.
And you're aware that a manual blood pressure cuff was found in a box, in a bag, in a cabinet, in another room?
It's not useful there.
And again, you find this to be an egregious violation?
Absolutely.
Dr. Shafer, you talked about the need to have an electrocardiogram when you administer sedatives such as propofol, and you found that to be, again, another independent egregious violation?
Yes.
Please describe your findings there.
You always monitor the electrocardiogram, which allows you to see two things. It allows you to see what the heart rate is. And the heart rate might go quite high or it might go quite low, but it allows you to monitor it. It also allows you to monitor how the heart is beating. Is it beating with a normal rhythm, or has it started to beat with an abnormal rhythm? This is absolutely routine monitoring. In this case, because we have no electrocardiogram, Dr. Murray can't tell us what the heart was doing at the time of the arrest. That shows why you have to have it. He didn't know how to direct his therapy because he was missing an essential monitor, a monitor of the electrocardiogram to show if the heart was beating. So he didn't know what kind of therapy to institute because the monitor was not in place. And that's why you always monitor the electrocardiogram when you are using intravenous sedatives.
You also discuss capnography or capnometry, and you described through the video what that measures. Was that a violation in the standard of care to not have capnography present?
Absolutely.
Can you describe that, please?
Yes.
And were you of the opinion initially that it was not a violation?
Correct.
Can you describe that, please?
Sure. There are many settings in the hospital where sedatives are given without capnometry. In anesthesia, it's a standard. But other specialties often give these drugs without capnometry. And I'll just say it's a point of discussion. But that's in a hospital where there's backup. So because sedatives are sometimes used without measuring the carbon dioxide, I initially said this is not a violation of the standard of care. In the months since I've written this, I've tried to envision the environment in which this was being used. Again, an environment with no medical backup. An environment in which if there is a problem, there is no emergency equipment, the resuscitation equipment is not there. It's a setup for disaster. Capnometry is your first warning. As you saw on the video, as soon as the patient stopped breathing, there was no longer carbon dioxide. It is the hair trigger warning. In this setting, to not have that hair trigger warning so that you would know right when the breathing stopped that there was a problem is inexcusable. I see that as an egregious violation, and I believe that contributed to the death of Michael Jackson.
And you evaluate that based on specifically the setting in which this was taking place?
Absolutely. In this setting, that is an egregious violation.
Dr. Shafer, you talked about the requirement for emergency drugs, and you found the failure to have such drugs to be a serious violation. Let me ask you first, what type of drugs are we talking about when you refer to emergency drugs?
That would be similar to the drugs, that would be the same as the drugs that were shown in the video. Drugs to raise the blood pressure in the event that the blood pressure fell too low, or drugs that would be used to stabilize the heart rhythm in the event that the heart entered an unstable rhythm. Drugs that would be used to accelerate the heart if the heart should get too slow. These are the kind of emergency drugs that anesthesiologists have available, and I found that to be a serious violation.
Now, you commented earlier that propofol results in a drop in blood pressure.
Yes.
So which drugs are you referring to that would work to boost that blood pressure or increase the blood pressure?
By name?
Please.
Yeah. The name of those drugs would be either phenylephrine, which is a drug that has a chemical resemblance to adrenaline, not quite the same, but there's similar resemblance, or another drug called ephedrine. Both of these drugs essentially increase the amount of adrenaline or have an adrenaline-like effect, and of course adrenaline raises your blood pressure. So they act through that mechanism, and those were the drugs that he would have available to raise the blood pressure.
Are there certain drugs that are used to help facilitate putting in place an endotracheal tube?
Yes.
What is that?
If the person needs to have a breathing tube placed in their windpipe, it is very difficult to do that if a person has their full muscle strength. Because to do that, you wind up fighting the jaw muscle, the masseter muscle, which is very, very strong. So anesthesiologists, or frankly, pretty much throughout medicine, everybody who tries to intubate patients and intubates patients gives a muscle relaxant. A muscle relaxant is a drug that paralyzes your muscles, so you have no muscle strength at all. When you have no muscle strength at all, you can then open the mouth fully in order to position the endotracheal tube through the mouth into the windpipe. In the case of anesthesia, we always have succinylcholine available for patients, except in very rare cases where patients actually have abnormal responses to succinylcholine. It's always available so that we can paralyze the patient, open the mouth, and get the breathing tube in place.
Now, why wasn't this failure to have emergency drugs an egregious violation in your mind?
I don't think that having the emergency drugs contributed to the death of Michael Jackson, because one should not get to the point that these are required. And other than the succinylcholine, one can usually treat what the other drugs are required to for the blood pressure by just giving more intravenous fluid and stopping the administration of propofol. In fact, in all of these things, if the propofol is stopped, it goes away fast enough that these drugs should not have been required. So I felt it was a serious violation.
And you're differentiating, again, because of the setting. Is that accurate?
Yes, and I'm also differentiating because in the case of Michael Jackson, if you turn off the propofol, he just wakes up. That's different from anesthesia, where you cannot turn off your anesthesia in the middle of surgery. If you turn off your anesthesia in the middle of surgery, the patient wakes up in the middle of surgery, which is obviously unacceptable. So you have to have these alternatives. But in the case of a person who's getting these drugs just to go to sleep, you turn it off and they wake up. It's not a problem.
If you're competent to manage it.
If you're competent to manage it, yes.
Now, in the operating room, if someone's actually undergoing a surgical procedure where they're cut open or something, obviously you don't have the option to just turn off the propofol, correct?
That's exactly right. So in the operating room, these drugs are essential because turning off the propofol is not an option.
You next talked about charting and documentation, the need to keep records, and you found this to be an egregious violation. Can you please describe that?
Yes. As I mentioned during the video, record keeping is not optional. Record keeping is part of the care of the patient. I can tell you that in virtually every case that I do, during the case I refer back to my record. The blood pressure seems a little high. Well, how high was it a few minutes ago? The heart's going a little bit faster than I thought. What was happening 10 minutes